you. Thank you once again to all those who are joining us and helping get our message out about COVID-19. Our lab-confirmed COVID-19 case now stands at 14, and that is up from the 4 that we had since we last spoke on Friday. This jump can be largely attributed to the backlog of tests being cleared at the labs. This jump was not unexpected, and similar rises in positive confirmed tests are being seen throughout the province. As more labs are being put into operation, up in capacity, we should see these kinds of backlogs being avoided in the future. I want to assure the public that BCHU is notified of all those who have been tested and are waiting for test results and are in contact with these individuals. Until a negative test has been confirmed, we instruct those awaiting results to self-isolate. Over the weekend, BCHU received confirmation of what appears to be our first case that indicates community spread. Community spread means people have been infected with the virus in that area, including those who, and some that do not know how or where they became infected. Since receiving that notification, we know that 2 of the cases since Saturday also appear to be acquired by a community spread. Again, this is not unexpected, as we've already had a confirmation of community spread from neighboring communities. While not unexpected, this should be absolutely taken seriously. This further illustrates residents need to assume that they can catch this virus anywhere, and thinking it's not in our community is a mistake. Orders to only leave home when absolutely necessary should be driving home that message that everyone needs to stay vigilant about this. Yesterday, we saw orders locally from our municipalities to shut down outdoor amenities. Today, we are seeing these orders echoed on a provincial scale. Until we get everybody buying into the guidance around physical distancing, I anticipate there will be more of these orders that will have to be handed down.
So thank you, Dr. Urbantke. We'll now open things up for questions.
Dr. Urbantke, can you tell us a little bit about where the patients reside? I know a lot of people are really concerned, wondering if it's St. George, Paris, Brantford, Scotland.
So I can't give specifics, especially because of the smaller communities. There is a mix between county and city of Brantford, where the cases are, and as we have a duty under the Personal Health Information Protection Act to protect the privacy of patients, including those who have tested positive for COVID-19. We always have to balance what information we give out and how that information can benefit the public and protect the privacy of affected individuals. With that said, through our case and contact management process, we continue to contact individuals who have had close contact with a confirmed case. And if a confirmed case presents a significant risk to the public that would make it difficult for us to identify close contacts, we would release this information widely to notify the public.
Are any of these cases in critical care?
I believe 2 are in critical care.
Does that mean that just two are in hospital and in critical care, or are others in hospital as well?
There are 3 in hospital in total.
Okay, 3 in hospital and 2 are in critical care. Okay, thank you.
You'd mentioned community spread. I'm just wondering if any of these patients were maybe frontline workers or people who are working in certain industries like grocery stores, pharmacies, drive-thrus.
There's been a variety. There's been no one specific class of worker.
Okay.
If I heard correctly, this was due, the significant jump from Friday to today is mostly due to a backlog of laboratory cases coming through. Is that correct?
It's certainly not only we've seen the jump in positives, but we also received a significant number of negative results over the weekend. I think over 80 to 100 results sort of came in all at once. So we haven't been seeing even that many negatives come in. And certainly if you look at the provincial website, the number of tests pending has dropped dramatically in the last few days.
Okay, all right.
The assessment centers are run by the Brant Community Healthcare System, so those specific numbers and how many they're being assessed, et cetera, would have to come from them.
Are you still testing between 40 and 50 patients a day?
Sorry, that the testing is done by the hospital system, not by us.
Okay.
One of the questions that's come out, and that I'm sensing this more than anything, is that timing is huge, and that this is somehow a crucial week in the battle against the pandemic. Can you comment on that? Is the timing more severe now or more important than ever now, or is there anything that you can tell us with respect to the timing and the importance of this week?
Yeah, certainly a lot of the physical distancing orders and other public health measures were put in approximately 2 weeks ago. And so this would be a critical week to see if they are going to make a difference in flattening the curve.
Are you optimistic now that outdoor recreational facilities, especially with the weather being a little nicer, being closed by the province as well as the municipalities, are you confident that will help stop the spread of COVID or at least slow it?
Certainly every little bit helps. Unfortunately, people were not adhering to the guidance given to them by the public health and provincial and federal orders. And so the further steps of closing park amenities had to be taken to drive this message home. So once again, the message, people need to be adhering to the physical distancing and self-isolation advice and orders. Ages range from under 20 years old to into the 60s.
Are many of the patients just showing mild symptoms?
The majority of patients are at home.
Thank you, Dr. Urbantke.
Okay, I can't think of anything else. Is there any other messages that you want to get out other than the physical distancing that we've talked about, Dr. Urbantke?
Everybody has to do their part, and if we all don't do our part, we won't be able to overcome this challenge. So I encourage getting the message out that everyone in our community has to do their part.